Hi, I'm Dr Yeshwant Mane from Atharva Infertility Center, Nashik. Being a practicing IVF consultant since last 15 years, we face many couples that they are worried and they are they have stress that is IVF treatment safe. IVF treatment is absolutely safe in today's practice. Few years, a decade ago, it was slight unsafe, like in the form of ovarian hyperstimulation syndrome. But with the better understanding of the subject, better availability of the drugs, IVF treatment has become 100% safe. The complications that were previously seen with IVF treatment were mainly related to ovarian hyperstimulation syndrome. Now, what is ovarian hyperstimulation syndrome, or in short, we'll just say as OHSS. First, we'll compare a normal cycle. During a normal menstrual cycle, a female produces one healthy egg. But the intent of IVF cycle is to produce 8 to 10 good quality eggs. So the clinician administers certain type of injections in a particular dose and for a particular duration. Some cases, especially those cases having polycystic ovarian disease or PCOS, they tend to hyperstimulate. Hyperstimulate means when the intention or when your goal is to have 10 to 12 good quality follicles, the patient produces around about 20 to 25 follicles. When the patient's ovary produces 20 to 25 follicles, then she is at risk for ovarian hyperstimulation syndrome. Now, the main culprit for ovarian hyperstimulation syndrome is HCG injection. If HCG injection is given, hyperstimulation is definitely bound to happen. Hyperstimulation is classified in three main grades: a mild, moderate and severe. Mild form of hyperstimulation is very common. It is treated as an outpatient problem with some antispasmodic and painkillers. Moderate and severe hyperstimulation requires close vigilance and treatment. Severe hyperstimulation requires hospitalization and treatment with IV fluids. But with better understanding of the subject, now hyperstimulation has been totally ruled out, as it has been completely eradicated, I would say. That's because instead of giving HCG injection, we administer GnRH analogs for oocyte maturation. Till date, we haven't seen any case of ovarian hyperstimulation with GnRH analogs. At Atharva Infertility Center, IVF has become completely safe with advanced technology, with state-of-the-art equipments and better knowledge of the subject. So at Atharva Infertility Center, since a decade, we are proud to say that it's a OHSS-free clinic. So IVF treatment for the patient in today's practice is 100% safe. The couple don't have to worry regarding the safety of the procedure. Apart from that, the safety procedures, when many patients ask, the patients are given a slight general anesthesia during oocyte retrieval. So anesthesia has some inherent risk, but they are not of major concern. So to conclude, I would say IVF treatment is absolutely safe, and couples without any hesitation should undergo IVF as advised by the doctor.